Hey guys, welcome back to our channel. It's Mel and Tink here.
Hello.
Did you say something?
I did. I'm so sorry. I thought you paused for me to say hi.
Hey guys, it's Mel and Tink here.
Oh gosh. Okay. I got it.
Hey guys, it's Mel and Tink here.
Hey.
Welcome to our channel. As you can see, we're doing things a little bit differently today. What are we doing today, Tinky?
Well, today we're going to do sort of like a podcasty video sort of thing. It's going to be a little bit different, but hopefully will be quite interesting because we're doing a little Q&A.
Yeah. And the topic today is Tink had surgery. What the hell?
Yeah, it's a long story, but we're going to try compact that story into a 20-second answer question round.
Hot fire questions. No, quick fire questions.
Quick fire.
Beautiful.
Mel's kindly written some questions, so I have no idea what she's going to ask me.
Yep.
Apart from the fact that it has some relevance to my surgery.
So let's start from the start. This is. I'm trying to ask you questions as if I know nothing.
Okay.
What did you notice?
Well, I guess I'll first introduce, it was on my left forearm that I had surgery, and there was a soft-ish lump on my arm, quite significant in size, sort of almost my whole forearm. So it's on the inside of the arm. I assumed it was scar tissue for a very long time because I had broken my arm as a child.
Mm-hmm. So you sort of noticed a change and it was just significantly different to what it used to be?
You know what? It was very gradual. It was a very slow process of it becoming, obvious to the eye. So it wasn't something that I woke up with overnight and then was like, oh my God, there's a lump on my arm. It was something that I'd always noticed was there, but perhaps I'd only recently noticed it getting bigger.
Yeah.
And I, unfortunately, did sort of treat it like that. And it wasn't until it was sort of causing me discomfort that I was like, maybe I should get it looked at, even though I'd noticed its presence prior to.
Yeah. What changed your perception of what it could be? Like, what was the pain like?
So the pain was intermittent. It wasn't consistent. It was more sort of like muscular pain.
Okay.
So you know how when you go to the gym and you get DOMS, it was sort of like that kind of pain, but it was like a dull ache. I think I would always attribute the pain to having recently gone to the gym.
Yeah.
And I was going to the gym often and I was doing arm weights, so it made sense, but it didn't make sense that one arm was sorer than the other.
Yeah, that's a little bit of a red flag, isn't it?
Absolutely.
So we're going to get into the quick fire questions, everyone. What made you go to the doctor in the first place?
Okay, I went to the doctor because my arm started hurting a lot.
Beautiful. Thank you. And when did you start really noticing a change to then go, this is not what I thought it was?
Well, honestly, I went to the doctor and I still thought, even when it was painful, that I still thought it was scar tissue.
Yeah.
And it wasn't until I was in an MRI having a scan that the thought came to me, oh my God, maybe this isn't scar tissue.
And what were the doctor's initial thoughts? What was the things that they were saying to you, what it could be?
Like some kind of fatty tissue in there that they could potentially liposuction out.
Mm-hmm.
It never crossed her mind that it could be something else, but she was obviously curious enough to send me for a scan.
See, that's the thing. It's like they don't know until they know. And
yeah, exactly right. You can't assume.
Yeah.
You cannot assume.
So what is it exactly that you had? What's it called?
Okay, so abbreviated version is AVM. I cannot remember what the A stands for, but essentially it's a vascular malformation. So exactly why it happens, we're not sure, but what they can tell me is that vascular malformations are typically formed from birth. So this has been my friend for 29 years.
I also kind of want to know, I know you said you had scans and stuff. So from that scan, is that how they then knew it was a vascular malformation?
So the first scan was an MRI.
Yep.
And the MRI revealed that it wasn't scar tissue. So that was the first thing.
Okay.
And I think in the conclusions, it did question some kind of vascular malformation.
Mm-hmm.
So that's when my GP then sent me to a specialist. He specializes in hands and arms.
Yep.
So he had seen vascular malformations before, and he was the one that was like, yeah, this is definitely what it is, but we need to do additional scans to see how involved it is with your arm. So I then had to do a CT angiogram scan.
Yeah, so essentially it helps work out how difficult your surgery is going to be, how successful they're going to be, and all of that sort of stuff.
Yeah, well, even if he could do surgery, because there's really important arteries in your arm, and he obviously didn't want to sever them. And that also included why they couldn't do a biopsy on it to make sure it was nothing sinister, because it was it was just covered in blood vessels. So if they punctured it, it would just bleed.
Now let's talk about the surgery that you had, because that's the interesting part, in the sense, you have anesthetic and all of that. So how long were you under?
I believe I was under for about an hour and a half.
Yep. It was a little bit quicker than they thought.
Yes.
Yep.
They did, however, have to remove a muscle. I can't tell you exactly what muscle it was, but it's if you turn your arm palm facing up, and that muscle that's, just where your forearm is, this guy, if you just slightly push on that one, that's the one that they removed. Apparently, it's a useless muscle, so I don't need it, but my arm definitely does feel weaker at the moment.
Now, this obviously isn't the first surgery you've had. You've actually had a much more complicated surgery prior to this. We're going to save that one for later, but we sort of learned that, it's not easy for you to go under the anesthetic. How did this time compare to the last time you went under anesthetic?
Okay, well, the last couple of times I've gone under anesthetic have been pretty traumatic. As a child, I went under for a hernia operation and I woke up very aggressive. But then obviously going in as an adult, I was very concerned that I would wake up aggressive.
Yes.
But I did tell my it's not, in Australia, we don't say anesthesiologist, we say
Anesthetist.
Anesthetist. That is a hard word.
Call them a sleep doctor.
The sleep doctor. Sleepy doctor. So my previous surgery before this one, I woke up very upset. Yep. And then I did tell the sleep doctor this time about my prior experiences. And he was like, I think there's something we can give you to make this a little bit better. I was like, okay. Anyway, I woke up and I was happy. I was smiling. I was talking to people. I wanted to see pictures. It was a completely different experience.
You're a different Talia.
I'm not sure what he gave me. I think it was Fentanyl.
Yeah, fentanyl.
Yeah. Fentanyl.
Good stuff.
And it was great.
Yeah. Now, I think the most interesting part as well is it's one thing to go under the knife and have the surgery, but the recovery is also what scares people and might put people off, getting things done like this. What was your recovery like? I
was in and out that same day, so I didn't have a night stay.
Yep.
And obviously you come out of anesthetic and you're just a bit sort of out of it and woozy. So I came home, they give you some medications to go home with, and Jason had set up, and we'll show you a photo. He'd set up my bedroom with lots of different balloons, and like a welcome home and, get well and, just very cute. Made me feel special and looked after.
Yeah. Yeah, he did a really good job, little cutie hands.
But my husband stayed home that week
Yeah.
to look after me because I was pretty much useless.
Yeah. How long has it been now since your surgery, and how is it feeling?
I think it's been 4 weeks since my surgery. It's currently, so I'm still in the process of treating it. So I was going to occupational therapy sessions just to make sure my fingers and the movement of my hand was fine.
Yeah.
Now I'm sort of doing exercises to make sure my wrist isn't stuck, I think because of the scar, which would you like me to show?
Yeah, please show the scar.
Yeah. This is, the video doesn't sort of do it a lot of justice. This is the guy. So it's important that I, keep it moving, not too much. And then I also need to massage the scar with vitamin E oil. And then I have another sort of compression stocking and bandages that I put over it on a daily basis.
And is it still itchy?
No longer itchy. It was very itchy at the beginning, and it was bloody annoying because I had a big cast on it. It was like a soft cast.
Yeah.
And I couldn't itch it. Like, when you break your arm, you can...
Yeah, you want to put a fork into your cast.
But you can when you've broken your arm because you don't have an open wound.
Yeah, that's right.
But this, I had a big open wound. Like, I couldn't just stick things down there. So I was just like, oh.
It's like teasing. It's like you really want to, but you can't.
We'll show you what it looked like, what came out, and what it looked like while they were operating. Yeah. And now I have a awesome story to tell. If anyone ever notices it, I'll be like, well.
Yeah. So we're going to do the warning now. This is where the photos are going to come in.
Graphic warning!
If you are not someone, again, we're warning you, if you are squeamish, if you do not want to see blood, please look away. This is the arm, this is her arm, and this is what's being taken out. And this is what her arm looks like now. So I think the reason we did this is because I think we want people to know that all this stuff is normal, whether you're 20, whether you're 10, whether you're 50, whether you're 90. These things can happen at any stage of your life. And I think it's just really important to know what your body looks like and know what's different, and then to go and check it out if you do notice something different.
Definitely. I think I have learned a big lesson to not assume I'm healthy just because I feel and look healthy. Yeah. Unfortunately, we're not children anymore, and mum and dad aren't sort of, they don't have all the answers for you. It's really up to you to understand what your body looks like, understand what it feels like, and understand when something is wrong or might just require a professional to have a look at.
That's right. And if you're thinking about it and it's keeping you up at night, but you don't want to go and get it checked out, that's probably meaning that you think yourself that there might be something wrong and you just don't want the answer. It's best to go and get that answer. The sooner, the better.
Definitely. And then you can have a really cool scar.
Exactly. You can be like Tink. But yeah, guys, that's all for today. I think we just wanted to catch up with each other as well because we've been missing each other too. And we just wanted to get something out there for you guys while you're all at home. We hope that everyone is doing well and keeping safe. And we'll see you next week.
Thanks for watching, guys. And if you like this video, hit the subscribe button, give us a like, and comment below.